All right, here is just sort of a representation of the abdominal viscera. This should be sort of step one for you as you start your lab. You want to make sure to take your cross cuts as far lateral as you can and take your vertical cuts as far low and as far high as you can and reflect those quadrants of abdominal wall widely so you have as big a view as possible. The organs will seem compressed and they'll need room to move around in order to get access to the vascular structures. So start by taking a walk through the different organs. Try to identify as much of the GI tract as you can before you start looking for blood vessels. So we're going to start this overview with the celiac trunk. So that's going to require being able to move the liver superiorly and push the stomach inferiorly. And so you'll have to be able to move those things around a bit, but I'm actually just going to move the stomach out of the way entirely and the liver entirely so we can look directly at it. Here is our celiac trunk branching anteriorly from the aorta. If you remember from lecture, it comes off at about the vertebral level T12. If we look at here's the vertebrae behind, this is L1 here. T12 isn't represented, but it would have been right here at the level of that celiac trunk. And also similar to our drawing in class, there's three major branches that come from the celiac trunk directly. The first branch we'll look at here is the splenic artery. This, as you can tell from this depiction, it has sort of a coiled appearance. That's very typical, and I don't think you'll have any problem seeing that. You might only see about this much of it because the stomach will be in the way for the other part of it, but it'll be easy to identify based on its curliness. From the splenic artery at its end, right before it gets to the spleen, there's also a left gastroepiploic artery, or gastroomental if you like, and that supplies the greater curvature on the left side. This probably won't be that hard to identify if you just look in the omental fat on the greater curvature of the stomach. You'll be able to identify this longitudinal artery. At the same time, the left side of the lesser curvature is supplied by a direct branch from the celiac trunk called the left gastric. So you should probably be able to identify that pretty easily as well. The third branch from the celiac trunk is branching in a rightward direction. It'll be almost horizontal and is going to be heading towards the liver with several other branches that are going to non-liver structures. So we're calling this artery the common hepatic. One of its branches is branching off and heading towards the lesser curvature of the stomach on the right side, and that's going to be the right gastric. And this is a pretty thin one. It's easy to break this as you're working through the connective tissue of the lesser omentum. So exercise caution if you're on the lookout for the right gastric artery. Another artery that branches from the common hepatic is the gastroduodenal artery. It comes off inferiorly, goes behind the duodenum, but anterior to the pancreas, and then emerges down underneath and gives off two branches, the superior pancreaticoduodenal, which supplies, as it might suggest, the pancreas and the duodenum, and the right gastroepiploic or right gastroomental, which supplies the greater curvature of the stomach and the greater omentum on the right side. So again, if you just work through the omental fat here, you might find this longitudinal artery quite easily. So turning back to the celiac trunk and the common hepatic artery, we've now gotten rid of all the non-hepatic branches, and we'll draw in the gallbladder, which you should have no problem identifying if you have one. It's very, very bright green. But then from the common hepatic artery, you might be able to see adjacent to it the bile duct system. It'll probably have the same dark green color that the gallbladder has. And you should be able to identify these three large vascular structures that are entering the liver: the biliary duct system, the hepatic portal vein, and the common hepatic and proper hepatic arteries that are heading up towards the liver. Typically, the artery is the most leftward structure, the bile duct is the most rightward, and the portal vein is the most posterior. So take a moment to identify the relationships in those structures. Then that pretty much takes care of the foregut structures in our dissection. Moving down to the midgut, we're looking at the small intestine and the appendix, ascending colon, and the transverse colon. If you remember from lecture, the superior mesenteric is the blood supply. It emerges from the aorta at about the level of the first lumbar vertebra, which is shown here. And then it has a long descending course, which will go posterior to the transverse colon and all the way down to supply both the small and large intestine. So we can see the artery and the vein here side by side. And then the colic branches, there's one branch that will continue down to supply the ileocecal junction. Occasionally this is really more of a continuation of the SMA as it reaches its termination, but in this case there's definitely a distinctive branch. There's also a branch that is supplying the ascending colon. This would be the right colic artery. And then there's a branch this is going to be a little bit harder to find because it's pretty high, a middle colic artery, which if you follow its course will take it to the transverse colon. So you have to go pretty high on the superior mesenteric to find that one. You should have no problem identifying an intestinal artery. There's many of these, and the ones that supply the jejunum are called jejunal, and the ones that supply the ileum down here are the ileal arteries. We just want you to find a couple representative examples, and you can remove the fat if you like to expose the mesenteric arcades, these loops, and then the straight vessels, the vasa recta. And if you remember from class, there's a sort of a morphological difference between the formation of these arcades and vasa recta in the jejunum versus the ileum that you should be able to identify just by removing fat from a high versus a low location. Turning to the hindgut, our blood supply is the inferior mesenteric artery, and it typically has three major branches that we need to find. A left colic artery, which is supplying the descending colon, and there may be a couple of branches of this as demonstrated here. There's usually several sigmoidal arteries that are going to the sigmoid colon, and the superior rectal is sort of the termination of the inferior mesenteric as it makes its way down into the pelvis. And again, you'll remember that the inferior mesenteric is usually coming off of the vertebral column around L3. And this example looks a little bit lower, but that's generally where we shoot for. Then let's turn our attention to the veins and work backwards. Inferior mesenteric vein parallels the inferior mesenteric artery, but then ascends vertically to reach the splenic vein here, which is draining the spleen from over there. So these two join together, the splenic vein continues, and then this will join up with the superior mesenteric vein, and the two of them will join together to form the hepatic portal. And then this hepatic portal vein will enter the liver. The very last step of the day is to work through some of the retroperitoneal fat to try and find some basic structures in the retroperitoneum, such as the kidney, the adrenal gland, and then the ureter. These shouldn't take you too much effort. Likewise, the aorta and IVC will probably be so large that you'll be able to see them through the retroperitoneal fat in most cases. So that takes care of this lab. Good luck.